Hi, I'm Dr. Robert Handy with Bucks County Orthopedic Specialists. I want to thank you for joining me today. Today's topic is shoulder pain from impingement syndrome. Let's go on into the office and learn a little bit more about impingement syndrome. Impingement syndrome is a continuum of diagnoses, starting with shoulder bursitis, progressing to shoulder rotator cuff tendinitis, and culminating in a rotator cuff tear. Impingement syndrome is associated with severe shoulder pain in the shoulder region, and the shoulder pain can radiate down the arm, to the back, and at times up into the neck. The shoulder pain can be brought on by many different things. Working overhead is a prime example. I see a lot of carpenters, electricians, and plumbers who come in with shoulder pain. Also, common household chores can cause shoulder pain and impingement. Just pouring a cup of coffee, reaching into a cabinet, sometimes getting dressed, reaching behind your back to put a coat on, or into the back seat of a car. All of these can cause shoulder pain and shoulder impingement. Tell me about your shoulder pain.
Well, it started about 2 months ago. It begins at my shoulder and then goes down to my elbow.
Does the pain go below your elbow?
No.
Do you have any numbness or tingling with the pain?
No.
Can you give me an idea of what activities you do that might worsen the pain?
Well, if I raise my hand up, or I try to throw a ball, or even just tucking my shirt in.
I'm going to go ahead and examine Henry now to see whether or not I can elicit the pain. Pain to palpation is somewhat variable in impingement syndrome. I'm going to go ahead and lay hands on Henry's shoulder and see if I can elicit some pain. Henry, I'm feeling along your collarbone here. Does that hurt you at all?
No, not at all.
Okay. Now I'm on top of the acromion bone. How about that? Is that painful?
No.
But when I reach down below the acromion bone and I press through your deltoid into your bursa, that does elicit a little pain. Impingement syndrome can also be associated with pain in the biceps region. And so as I feel right in there, yes, you have a little bit of bicipital pain. Okay, now we're going to start some exercises to help strengthen Henry's rotator cuff muscles. By doing this, by strengthening the rotator cuff muscles, we can help minimize the symptoms of impingement. The first set of exercises we're going to accomplish are internal and external rotation exercises. Henry has an exercise rubber band called a TheraBand attached to a doorknob, and just for better grip purposes, he's wrapped it around a dumbbell. Henry, go ahead and start doing a set of maybe 10 internal rotation exercises using the TheraBand. Henry's keeping his elbow at his side. He's bringing his palm all the way into his abdomen. And in so doing, he's strengthening the internal rotators of the shoulder, part of the rotator cuff. I had Henry switch hands so he didn't turn his back to the camera. At this point, we're going to strengthen his external rotators. Henry's going to start at the starting position, which is palm at his stomach. He's going to keep his elbow at his side, and he's going to start externally rotating. Go ahead and externally rotate, Henry. Excellent. Go ahead and accomplish about 10 of those. Normally we'll have people do 2 to 3 sets of both internal and external rotation. And a set can consist of anywhere from 10 to 15, maybe even 20 rotations. It's important to work both the internal and the external rotators. Sometimes folks have a problem keeping their elbow at their side, and we have a little solution for that. If you do have a problem keeping your elbow at your side, it's a simple solution. We've just rolled up a towel and tucked it under Henry's elbow. Now he'll repeat the exercises using the towel to help further support the elbow. Go ahead and do some external rotation there, Henry. This towel is a simple solution if you're having elbow trouble. That is, trouble keeping your elbow at your side. Henry's now in the starting position to work on his scapular retractor muscles. It's important in impingement syndrome to not only strengthen the rotator cuff muscles, but to strengthen all of the muscles around the shoulder girdle. The next set of muscles we're going to work on are the muscles which bring Henry's shoulder blades together. It's more or less a rowing exercise. We can again use the TheraBand attached to a doorknob or something waist high. Henry, go ahead and do your rowing exercises. It's important to keep the elbows straight during this exercise. What you're trying to accomplish is moving the shoulders from approximately 30 or 40 degrees of shoulder flexion to perhaps neutral or maybe a few degrees of shoulder extension. And you want to squeeze the shoulder blades together as you reach that fully extended position. Okay, Henry's now positioned for working on internal rotation. Here his left arm is helping to pull his right arm up behind his back. Again, this is a passive motion, just pulling the arm gently upward to the point of maximum internal rotation.